Hey, good morning, Monadnock region. Dr. Matthew here at Evolution Chiropractic. I'm going to share a presentation that I gave to some doulas at the Cheshire Medical Center the other night. It's called The Role of Chiropractic in the Prenatal Population or Patient. This is going to be mainly focused on in utero constraint and fetal malposition and how chiropractic can play a role in relieving some aches and pains of moms. So let's get started. If I can figure this out. All right, so check it out. So role of the chiropractic patient. We're going to start here. So the role of the chiropractor in the prenatal population. So many symptoms, moms experience many symptoms. Some of those symptoms are neck pain, shoulder pain, sciatica, pubic symphysis pain, right? Lightning crotch or pain anytime their legs start to spread open. Some moms get headaches. Some moms get nausea. Some moms have postural symmetry issues. Here's the deal. Many individuals will utilize NSAIDs for some of these things. However, in the prenatal population, you can't really be taking NSAIDs. And sometimes getting massages or getting injections is not necessarily the thing that mom wants to do right away. So the medical authorities have actually recommended a conservative approach to care. So if you look here, the American College of Physicians have recommended that for acute or subacute low back pain, that spinal manipulation can be very beneficial. The FDA has said, hey, don't use pharmacologicals during this time, and you should be utilizing chiropractic. And then again, the CDC says, hey, don't use these opioid type things when you have this discomfort. Again, these are pain patterns, and pain patterns with a pill, it just suppresses the pain. It doesn't necessarily fix what's going on. So if you're a mom and you're experiencing any of these things on this left side, so neck pain, shoulder pain, any of that kind of stuff, chiropractic can play a really beneficial role for your relief and ease of symptoms. Again, here's some just evidence-based manual therapy. Again, this talks just about individuals that take these types of things, NSAIDs or Tylenol, they're not helpful, right? In the long run, they are not helpful. And so to utilize them as a thing of like, oh, I'm going to take this, it doesn't help, especially during your perinatal journey. So think about that next time you go for the medicine cabinet. Is it really going to help you, or is it just going to hinder and suppress some symptoms? Let's talk about the role of the pelvis. I have a pelvis somewhere. So here's my pelvis. The pelvis, right, moves, right? The sacrum nods, the iliums rotate, right? There's some really cool biomechanics that happen in the pelvis. And you got to think, as moms grow, ligaments and fascia start to stretch, organs get smushed, and baby grows bigger in here. So if you look at this picture, here's the uterus. And again, there's lots of ligaments that attach to the uterus. And then here's a side profile. Here's the round ligament. There's the broad ligament. There's the uterosacral ligament. Again, these are ligaments that the chiropractor can actually work with through the Webster technique. And so if you're experiencing discomfort in your belly, right, in your maybe the fascia of your belly or your pubic bone, these are some areas that the chiropractor can help alleviate some discomfort. The reason I bring the pelvis up is because the pelvis needs to be able to move through a nice range of motion for the birth canal to open. Right. So if the pelvis is stuck in a position, the birth canal is going to have trouble opening, which could then cause some form of dystocia or slow, prolonged labor. So Williams Obstetrics talks about 3 leading causes of dystocia. Just means slow labor, right? And people that are in birth don't want to necessarily have like a slow, long labor. They want to have labor. They want to have their baby. So power is one of those 3 P's that cause dystocia. Power is the ability for the uterus to contract rhythmically, right? So the uterus gets information from the thoracic spine and the sacral region. So the thoracic spine gives its contractile ability. The sacrum gives its like slow down, relax ability. So if those things aren't talking well, or if there's fixations in the spine above or below these areas, it could impact the power of the uterus to contract. The passage is the maternal bony pelvis and soft tissue. So think glutes, piriformis, diaphragm, all this stuff touches your pelvis. And if any of those areas are stuck or not moving well, then your pelvis might not be able to open very well for baby to descend into birth canal. And then the passenger themselves is the baby. So if the baby's position is in a funky position, a lot of OBs will say, hey, we're not going to let you deliver vaginally because baby's not in an ideal position. Or midwives will say, hey, baby's breech or baby's transverse, we need to make sure that we're doing some sort of body work to open that up to encourage baby to get into the optimal position. So when the pelvis gets into a dysfunctional biomechanical state, this can cause abnormal joint fixation, which then causes muscular imbalances. And a lot of those contribute to pain patterns, but that can also contribute to possible dystocia of the birth itself. Additionally, weight gain, right? Moms are gaining weight. Their posture is being compensated as their belly grows. And then hormones. So the hormone relaxin is being more induced into the body to, again, prepare the pelvis to open. But these things can contribute to pelvic misalignment. So if there's joint fixations, if there's symmetry problems, right, this can lead to in utero constraint and fetal malposition. So why are we talking fetal malposition and in utero constraint? So this next, I think it's in two slides. I'm going to jump to it though. So if you can look at these pictures, right, here are some pictures on the left side of fetal malposition. So we have a baby in a breech position with knees kind of up by their chin. We have a baby in a transverse position. And then we also have a baby in a longitudinal lie vertex position. So this isn't bad. But we're thinking, okay, can baby be in another position? If they're like this, they can also be face kind of brow forward, right? Face kind of in extension, or their shoulder could be tucked in there. So if these are confirmed, right? If there's fetal malposition confirmed, you got to think, all right, if my baby's in a funky position for 9 months, right? Maybe 7 months, what's that doing to their physiology and anatomy? We can look at some of these pictures. So this is a picture of a baby that's been breech birth. So again, just compression of the head. A lot of babies that are breech will have some sort of dysfunction with their feet. It could be club foot. It could be hip dislocations or hip dysplasia. A lot of jaws will be impacted. So a lot of moms a lot of kiddos that I work with will have some sort of latch issue. And then we think, all right, was there in utero constraint pushing on that jaw, creating compression of the jaw? And again, moms that are in malposition, or if their pelvis is funky, they're going to have tighter fascia. Again, tighter fascia may lead to the inability for the uterus to contract well, or the inability for them to get into certain positions. There's something called Wolff's Law and creep is when connective tissue hangs out in a position, it'll assume that position. So if you're sitting in a chair, you're often chair shaped, and so your connective tissue is shorter in that region. And again, if moms are in pain, they're going to want to avoid certain movements. So chiropractors can help the body and brain talk to each other. So we can encourage moms, hey, you're not in this much, what's the term I'm looking for? So if there's fear of movement, we just have to show mom, hey, it's okay to move in this position, and you're not going to harm yourself if you move in this position. But sometimes they need that guidance and facilitation. So let's go back up. So the reason we want to focus on ideal position for baby and ideal biomechanics for mom is because of the risk of cesareans or external cephalic flips. I've had a couple moms the past couple weeks that one has had to actually do an external cephalic flip. But let's be real about this. If any of these factors are present, if there's difficulty palpating the fetal head, if there's a tense uterus, if there's an anterior placenta, or if the fetal spine is anterior or posterior, the success rate of those is low. And so we got to think, well, if the uterus is tense and we try to go in and manually flip a baby, that puts risk on baby, that puts risk on mom, because moms are having to get epidurals for this now. But if we can relax some of the fascia around mom's pelvis and around mom's belly, these things will start to find ease. And when they find ease, the baby naturally knows which position to go into. Actually, the presentation I gave at Cheshire, so in 2021, there was about a third of births were cesarean. However, when I brought this up at Cheshire, Cheshire said that only 19% of their births are cesarean, which is low, which is good. It's still 19%, and we want to decrease that. It'd be ideal to decrease that if we can. And again, when they're cesareans, there's going to be a lot of torque and rotation on this baby's head, and that's going to can cause a lot of discomfort in baby, and that can manifest as colic. It can manifest as difficulty latching or difficulty rolling their head both ways, and just an uncomfortable baby. So if your baby was cesarean and you're noticing these things, definitely come get them checked. We can look at their spine. So when's an ideal time to come to a chiropractor? Really whenever you want, but if you've never been to a chiropractor and there is position confirmed via ultrasound palpation, get in, right? Ideally as early as the 7th month for the quickest outcomes. And then we're going to monitor that pelvis and the spinal biomechanics until that birth. And again, if there's any MSK complaints, so if there's any neck pain, shoulder pain, low back pain, pubic bone pain, if any of those are present, come to a chiropractor. One that's Webster certified ideally is the best for you, and one you vibe with, right? I don't vibe with everybody, and so I don't want to be everybody's chiropractor, and not everybody wants me as their chiropractor. That's okay. We can find a chiropractor that you vibe with so that you have the best outcomes. So what is the Webster technique? A lot of moms will ask this, like, oh, I've never heard about it, or I was Googling it and this could be a thing for me. So the Webster technique, put simply, is really just an evaluation of the sacrum, right? Evaluation of the pelvis and the biomechanics, seeing what is tight, what is loose, what needs to be opened up. Right. And then it's a biomechanical adjustment. It's a very specific adjustment to the sacrum, to the pubic bone, to the regions around the sacrum and the lumbar spine. And it's specific contacts to restore function to the pelvis. Right. There are very sustained contacts that I will hold, contacts that are going to be gentle in nature, that will open up the fascia around the pelvis and around the belly so that it naturally will decrease in utero constraint patterns, right? I'm not claiming to flip or maneuver baby, right? But what I am doing is I'm working with the pelvis. And when I work with the pelvis, the baby's intelligence and the mom's intelligence says, cool, I want to go down, head down, because that's the best way for me to exit this birth canal. Average time of results, because that's the next question I get, is how long do I have to be here? It really depends on your case history, right? Depends on the chronicity of your patterns, depends on the chronicity of malposition, if there's confirmed malposition. But typically I see results within 3 to 10 sessions over about a month period, and then ongoing monitoring if the mom chooses to do that. What else do we do in the office? We do full case history and exam, obviously. We recommend exercises. We will send you videos of exercises. And then we'll teach husbands some things that they can do during the birth process, during the labor, so that they can support you, but also be in control, help be a part of the process. So many dads take this backseat approach to birth, when if dads were to take more of kind of like this mountain approach of like, all right, I'm here and I'm going to help guard this mom as she births. If fathers start to see that and see their women go through a beautiful and empowered birth, dads start to say, wow, man, there's a beautiful intelligence within her body and she is capable of anything. And then you start to have this affinity for the human system and say, wow, dude, our bodies are awesome. Our bodies can do these things naturally and without intervention. And then we just offer birth skills, right? Movements, positions that people can get into, positive affirmations. So many moms are stressed out during their pregnancy, and they feel very rushed at a hospital and feel very confined at a hospital with having to wear masks. And it's just not very personal in certain spaces. And so utilizing a chiropractor as part of your birth team, or as someone that you utilize to either alleviate discomfort or help kind of balance your pelvis, can really empower the individual who's about to give birth. Postnatal benefits. So everybody thinks, okay, I did my Webster technique. I got, the best I did. But there's also postnatal benefits with chiropractic. So one is pain, right? So if you have low back pain, if you have pelvic pain, if you have shoulder pain from breastfeeding baby, maybe there was a pretty intense bout of your labor where you were really bearing down or really like straining, your body might be in discomfort. And so if your body's in discomfort, chiropractic care can really be beneficial postnatal. Also think mental health, right? Moms that go into labor, or moms that utilize either midwives or a birth center or an allopathic medical setting, you have a lot of appointments building up to that birth. And then once birth is done, right, you don't get many appointments. You don't really get to see your provider that often. If you're in a midwife setting, you do. But if you're at the hospital, you barely go back. You go back at 6 weeks, and usually at 6 weeks they say, do you want birth control? Which is crazy. So many moms utilize chiropractic postnatally for mental health, right? Community support, mind-body check-ins, just talking about the birth process, anything that they're noticing in their kiddo. Because often if you go to the medical doctor and ask questions, they'll say, it's fine, don't worry about it, they'll grow out of it, or here's a pill or potion for it. And that's not always true, right? Sometimes kids won't grow out of it. They'll grow into more chronic things. And there's some really simple things we can do in the office which can unwind stress. We also help with nutritional recommendations, and just, again, recovery and support. So I always recommend moms take it slow after birth, but then we have to start focusing. All right, how do we start breathing again? How do we start to bring awareness to our pelvic floor and to our diaphragm and to our belly? Because those are really, really important structures that we need to re-educate after this process, right? There was a lot of compression in that area, and now there's a lot of space. But where there is space, there's opportunity for growth and evolution. Some common questions I often get, and this is the end of my little presentation, but some common questions I get are, how is chiropractic different than PT? Because why can't I just go to a PT for this? One, it's the biomechanics, right? A PT is going to do really, really good work with the muscles and with strengthening and rehab of certain ranges of motion. But a chiropractor is really going to go after the joint itself. And where there is joint fixation, what takes a PT maybe 30 minutes to do takes me like 30 seconds, right? So that's where chiropractic is different than PT. Is I'm quicker, I'm focused on that joint, we're opening that joint, we're stimulating the muscles around it, we're firing the muscles around it in a shorter period of time. So it's a lot easier. How will the prenatal patient lie on the table? I have these really comfortable pregnancy pillows that moms like to lay on. Children are always welcome at our office. Brittany will hold babies if babies are here. We've got tons of toys and dinosaurs around the office for your kiddos to kind of find and play with. And then again, it depends on how often you need to be seen based on your case history and your goals. The adjustment does not hurt. It's usually very relieving for individuals. And then, are there any contraindications of care? If you are a high stress or high risk pregnancy, I think it's wise to communicate with your OB, and me and the OB can talk about your case. So if you feel like, hey, is this really the best place for me? Let me talk to your OB, let me talk to your midwife, and we'll discuss if this is the right place for you. These are just some photos of the Webster technique. This was a mama that I got to take care of. So this is some blocks that we use to help balance the pelvis. This is a round ligament contact. To again open the belly and bring ease to the belly. This is what a sacral adjustment looks like. So I'm not twisting and popping joints. I'm just gently holding. And then sometimes I'll use an activator. So an activator is just an instrument that I use that delivers an input really quick to muscle spindles, which can bring a lot of ease to moms. So that is the role of the chiropractor in the prenatal patient. I flew through this just because I have a client coming pretty soon. And if you have questions, please reach out. Cheers.